So I just had a follow-up with Dr. Schimpf at Sweetgrass about my boobs. I got a breast reduction. They can only remove like so much tissue at a time. And he's going to go in and take more tissue because now my nipples are healed, everything's like attached, blood's flowing, everything's great. So he's just going to do an incision like under my breasts and then take more tissue. But while I'm in there, because I'm about to be 41, which I feel like 40 didn't really happen because I turned 40 like right before the world shut down. I've got a filter on right now so you can't see it, but I mean I've got like some super crepey skin under my eyes, and like one of my lid, I think this lid's a little bit drooped, like they're uneven. I know this is totally vain, but he's going to do a little lid action while I'm under. I'm going to do what I can to just try to not do anything too drastic, but just try to maintain what's left of my youth for as long as humanly possible. I mean, I don't want to like look crazy, and that's why I trust Dr. Schimpf. Obviously, wants you to be happy with your results. So yeah, so I'm excited.
Morning. So I'm not nervous at all. Last time I was a little bit nervous because I was just still kind of getting used to the idea of having smaller boobs. But this time they're already small. They're just gonna be a little bit smaller, and I'm totally good with that. And it all basically feels like I'm going in for a dentist appointment. Just looking forward to waking up, and hopefully Michael will take me for some Chick-fil-A nuggets again. I'll probably look pretty bad with the eyes afterwards, but I'll keep you guys posted.
Literally just left Sweetgrass, like right down the road. I'm a little bit difficult to look at right now. I feel great. We just like pit stopped at Chipotle, so he's getting me a burrito bowl thing, or rice, I don't know what they call them here, rice bowl. But I feel great. I like cannot even stress enough like how sweet the staff is at Sweetgrass, because I'm like yip, 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 talking, but they're all just like, I don't know. I just came out of anesthesia, so I'm a little like, woo, loopy, but I really just can't stress enough like how just great my experiences have been. My hero. It's like 6 something. I think my surgery wrapped around like 3:45 maybe. I probably got home around 5 with traffic. So I've downed my Chipotle meal because I was starving. Now I'm preparing Odie's scrumptious gourmet meal. But feeling good. I'm probably gonna lay down after this, but I just wanted to get the animals fed. Michael's finishing some work upstairs, but I feel great. Like right now I just have, maybe I can feel, that it's sensitive under here. I've got medication down the hatch and it's totally tolerable. I feel like giddy, a little bit loopy, but I'm like fine on my feet, no nausea or anything. This is a few hours post-op of a breast surgery, and I know I'm hard to look at right now. The funny thing is I already feel like I can see improvement because my skin is so tight underneath my eyes, like no crepiness to be detected.
So a couple things. I'm one of those rare people, I think, that cannot sleep well on pain meds. I just feel like I'm in a constant state of like twilight, but not actual sleep. So, but I had some good rest last night. The problem is my eyes, because they're swollen, they don't really close all the way. So I found a trick, and it looks ridiculous, but this is what I did. Found a comfortable position. I was trying to sleep last night. I could just barely see like lights like through my eyes. So I took this and like wrapped it like this, and just the extra little like squishing of my cheeks, I pushed my skin up just enough to not harm my incisions or anything, but so I could close my eyes. So that's how I slept all night, but it worked. And I also just want to explain this Band-Aid, which is totally my fault. So when they were bringing Michael back to me yesterday, I had like a little bit of blood dripping down my face. So I was like, let me wipe that up, because I didn't want him. And this is me, like, after just coming out of anesthesia, I'm like worried about Michael being freaked out. So I was like, I don't want him to see blood and like be squeamish or think it's like a big deal. So I was like wiping it. The surgical tape along this suture line hadn't set yet. And I think like I wasn't looking at what I was doing. I like slid the surgical tape down, which I had no idea. And when I got in the car, I was like, this is how it was like going straight across instead of like this one. So I was like, oh, that must be like that for a reason. But after getting home and taking a closer look, I was like, I don't think it's supposed to be like that. So I sent out a couple messages to like 2 of my contacts at Sweetgrass. They got in contact with Dr. Schimpf right away and got back to me, and they said like, it's not a big deal. It won't, because I was like, I'm really not concerned about it, but I just want to make sure I don't like undo his beautiful work. So they told me just like put this Band-Aid just to kind of like, to make sure that the suture line like stays closed like it's supposed to. So that's what this Band-Aid's doing. It's just kind of pulling up on the skin there. But yeah, we're all good. I know I'm so hard to look at right now, but it doesn't hurt. Like, it really does not hurt at all. My face looks so bad, like you kind of forget about my boobs. No, I'm still hard to look at. But it's hard to believe this is 2 days post-op. I know I look terrible, but I actually almost didn't even take pain medication today. I have a follow-up tomorrow morning. I'm gonna stop taking pain meds tonight so that I can drive and everything tomorrow, because I ended up taking them this morning, but I was like overdue to take them and wasn't really feeling any pain. So I almost didn't, but I was like, I'll just try to stay ahead of it and make sure today's comfortable, and then I think tomorrow I'll be able to switch to Tylenol. So yeah, things are good. Like, I look like hell, but I barely even notice that I've had breast surgery, because I just have the incisions under here and some cleaning and stuff. Yeah, like, other than how I look, I feel great. And tomorrow I should be getting my sutures out of my eyes already. It happens that quickly, so exciting. See, I can almost look normal. So I'm getting ready so now I'm 3 days post-op. I'm getting ready to go for my follow-up here at the West Ashley location. It's my first time here. I think that I get my sutures out today. So, my eyes, not my boobs, just the eyes. So I'm excited. It'll be nice too, because right now, like, some of my eyelashes are like stuck underneath the surgical tape. So it'll just be nice once all that's taken off. This place is huge. So I got a bunch of the tape off. It's actually still a little bit too soon to take off the sutures, so I'm gonna get those out on Monday. And I gotta clean up like where there's still dried blood from like where the tape was. But yeah, had a really good follow-up. Everything looks great. Everything's healing how it's supposed to heal. So I look like hell still, but I feel good. Like, I don't know if I mentioned this earlier, but I haven't even taken any pain meds today. Last night I took some Tylenol before bed. But I woke up this morning and I felt fine. So I haven't eaten anything yet. So I didn't want to like take something and upset my stomach. I gotta eat something and take my antibiotics and everything. But yeah, so all in all, good update. So we're 4 days post-op. I just washed my hair for the first time since the morning of surgery, which felt really good. I was afraid to wash it before my follow-up yesterday because I wasn't sure about like getting my eyes wet, but Dr. Schimpf said it was fine to like let water, run over them. So that felt nice, to not have greasy hair. I haven't been taking pain meds since 2 days ago.
Like I've taken Tylenol, but not anything stronger than that. And I haven't taken any Tylenol yet today. So yeah, pain is like minimal, but obviously it will be nice to not have like tape around my eyes because it's just a little bit annoying. And then to not like eventually have to wear the surgical bra. And what I did, because my bra was just like annoying me because it's like, just, it's tight. It's like digging into my skin. I mean, imagine wearing like a bathing suit or just any bra 24/7. Like it just gets annoying. So what I did was I had like a old Cuddle Duds brand fleece. And I put that on first after I got out of the shower, and then I put my bra over it. And I do have like a little like additional padding over top, but all my sutures and everything are taped up. Like I'm already healing really well, so I don't have to have like bandages on top of the sutures. So anyway, so this is much more comfy. Just got my eyelid sutures out. I'll show you guys what I look like, but I still look crazy, so still have lots of bruising, still pretty rough to look at, but and really this is just, I need to clean up the tape was and stuff. That's mostly just like dried blood. So once I like cleanse the area really well, it should look better. I still have the bruising, but it's gonna go away eventually. I'm so excited because just the whole crepey skin factor is already exponentially better. So if you look past the bruising, things are looking up. I forgot that I'm supposed to be putting Vaseline on my incisions also. Oops. So hopefully it's not too late for that. So they're a little shiny and slimy right now because I just put some Vaseline on them. So anyway, hopefully my bruising goes away soon, but I can put concealer on to cover it up a little bit so I don't look so difficult to look at. But it's like they're already almost healed. And this is where the tape had come off. So it's like a little bit more scabby here. If I can look past the bruising, can already see a huge difference and everything's like smoothed out because there's just not as much skin there. My skin that I do have there is still thin and has the potential to be crepey, but there's less of it. And then the upper lid, I was less focused on that, but I'm so glad that we did that because, before I used to have just that drooping and I would get, mascara stuck on my upper eyelid and eyeliner because my lid would, rest on my lash line. So today I am 2 weeks post-op. I'm still pretty difficult to look at just because of the bruising, but if you look, like I just have like a little bit of scabbing and I'm not like trying to pull off any scabs. But the lines are fading. Like you can barely see where, like this is where the one incision was. And the other one's up here. So I never really had any pain. Just like if I do like press on my eyes, it feels like sore, like maybe, you bumped into something, but otherwise it doesn't hurt. And my skin just feels kind of funny. Like it feels like it's lost a little bit of sensation, but I think that goes away. But yeah, so all in all, so this is 2 weeks out, and if I wore makeup to cover up my bruising, I could probably look semi-normal. Overall, I am extremely pleased with my results. I had a wonderful experience, easy recovery. The only thing that was sort of dragging on with my recovery was I had stubborn bruising that just took forever to go away. I don't think that that's entirely common. I think I had more bruising than most people, but it wasn't an issue. I put makeup on over it. But otherwise, like pain wise, everything was super simple. I do get a lot of messages about this procedure. And for me, it's tricky because I had a great experience and I feel like I can recommend it. But we all deal with things a little bit differently. For me, I don't know. I've been very, I've had my 2 breast reductions in the last 2 years, and then had the lid surgery. I just really was kind of laid back about it. As far as like, I wasn't concerned about my results. I knew Dr. Schimpf was a great surgeon, and I trusted him, but also, I don't know, I wasn't stressed about, I knew if like my results weren't perfect, then makeup can cover it up. It just wasn't, it's not something that I obsess about. Like, I don't obsess about scarring, that sort of thing. But the slippery slope with plastic surgery, and why it's, I can't just like make a blanket statement that I recommend anyone who's interested in getting this procedure to go ahead and get it, is for that reason. Because some people do obsess over scarring, and it really affects them mentally. When I got my, my breast reduction, like I mean, again, I'm happily married. My husband, has seen all the good and the bad of me. He didn't care about my scarring, and I didn't care if he did care, honestly. But I didn't care about the anchor scarring of my breasts. And as far as my face went, if I did have scarring from my lids, I knew I could cover it up. But I know not everyone has that same mentality, and some people can really affect them emotionally. So it's just interesting, because the people who are most interested in plastic surgery, because they, really want to put their best face forward, try to, do the best that they can with their appearance. Those are sometimes the same people who will obsess the most about their results. And if they don't achieve absolute perfection, and it's really just impossible to get perfection. We aren't perfect beings. My brow bones are asymmetrical. My eye sockets are asymmetrical. One of my earlobes hangs lower than the other one. Just objectively, we're not perfect. So if you're getting plastic surgery because you think you're going to get absolutely perfect results, and you're not going to have a single, crease under your eyes after you get a lid lift, that's just not how it works. They can't pull your skin so tight so that you don't have any wrinkles under your eyes, because then you wouldn't be able to naturally close your eyelids. That would be super scary. So just when it comes to the face, just definitely really think through whether you're a person who can cope mentally with your results, whatever they are. Make sure that you trust your surgeon. Make sure that you are realistic about your results. I see people obsess over like certain scarring, and I'm just like, oh, you're crazy. Like, you look amazing. When it comes to the face, that's just something that you really have to think twice about, because it's your face, and it's the face that you've known all your life. So if there's a tweak to it, you're going to notice it and not quite feel like yourself for a period until you get used to that slight change. But you do get used to it. And, at least I did. And it was, so if you're going to have a hard time dealing with results that aren't quite what you expected, then, maybe think twice about it. Maybe seek counseling, take your time making the decision. But generally speaking, I had a great experience. I'm very happy with my results. I knew no matter what, it was going to be an improvement to where I was before. And that is that's exactly what happened. So, do I still have some crepey skin under my eyes? Absolutely. Because again, you can only take so much skin. You still have to be able to close your lids. That's where we're at. I use a good eye cream. But anyway, with that said, I'll let it roll and you guys can see my